Turning now to a very hot topic. In 2019, a 23-year-old Colorado man died after being injected with a powerful sedative by a paramedic after a confrontation with police. 2 paramedics were found guilty of criminally negligent homicide, and understandably, this court case sent shockwaves through the rest of the first responder community. Here with us now is attorney Stephen Wirth with how we should adapt to this new development. Pleasure to have you today.
Thank you, Archer. Great to be here.
Well, I wish that we were talking about something a little bit more positive.
Yes.
We're talking about this Elijah McClain case. It garnered national attention. Can you kind of set the stage for us and explain what happened?
Well, basically, Mr. McClain was walking home minding his own business and was confronted by law enforcement because someone called in and said, there's a sketchy person, you might want to check him out. And literally within seconds, he was brought down to the ground in a prone position. Chokeholds were applied, and then EMS, fire rescue, arrived. And very quickly, they decided to administer ketamine. And unfortunately, part of that process, the whole case involved the extent to which they assessed or didn't assess his condition in the first place, and whether it was indicated to give him the drug and how much was given, and a lot of other factors. But the bottom line is too much ketamine was given to Mr. McClain, and he unfortunately passed away a couple of days later.
The use of a sedative, the use of ketamine is not out of the ordinary.
No.
Okay.
Not.
Does dosage matter when it comes to the use of this substance?
Dosage matters a lot. You got to get the dosage right. But even if you get the dosage wrong and you get the dosage too much, you give the patient a little too much, as long as you properly assess the patient, you have the equipment at the side of the patient to monitor the patient's condition and to manage airway issues if they vomit or if their pulse drops, that sort of thing, you can manage those sorts of things. And that was a big issue in this case, too, as to the extent to which an assessment was done initially and after the ketamine was given.
So like I mentioned, 2 paramedics were found guilty of criminally negligent homicide.
Yes.
There are no clear lines of division on when the police officer should step back and let EMS take over. Is that where the waters get muddied?
That's right.
Okay.
You hit the nail on the head. There is no clear demarcation of that. And we need to work on that. We need to work with law enforcement. We need to come up with checklists. We need to do joint training with real live scenarios of patients in custody and how we deal with them, patients who are fighting. Hey, we practice a lot of different scenarios. You know, we practice treating cardiac arrest patients or multiple trauma victims or mass casualties. We've been weak at and have not done enough of training involving mental health patients that are difficult to deal with, patients in police custody, patients who are kicking and screaming and yelling at us and treating us disrespectfully, you know, because we're all human beings. We tend to react to those sorts of things.
You say that paramedics across the country should not despair based on the results of this case. What are your takeaways from this case? Have there been any new changes implemented as a result of the Elijah McClain case? Yeah,
a lot of changes. I think, first of all, we're doing more training, and that's important. We're getting medical directors more actively involved, okay? We're throwing away this so-called diagnosis of excited delirium, okay? It's a catch-all to say, okay, give them ketamine, okay? We've seen that happen, okay? So we're doing a lot of training. I think we're seeing protocol changes. We're seeing better training in terms of recognizing the biases that affect all of us, okay? In terms of patients we treat, making sure we're treating everybody equally, fairness, with dignity. So a lot of things. It's been a wake-up call, I think, and a good wake-up call in the sense we can take these tragedies, because it's more than the Elijah McClain case, there's the Orr Moore case, there's other cases as well, and learning from them. And that's the key, learning from them and doing a better job. We can always improve, and that's what we're seeing across the country, and we've been working with a lot of departments in that area.
Right, because whether you're in the firefighting realm, you're an EMT, saving lives is at the bottom of what we want to do.
That's right, you know, and being respectful, you know, just acting, you know, like you care about somebody, showing that empathy toward that person's situation, and don't judge them. You know, part of the problem is, hey, people in fire and EMS, they're dealing with people in their worst moments.
That's true.
They're yelling at them, screaming at them, spitting at them, kicking them, screaming. We don't judge people. Whether they got into that situation, whether they're on drugs, whether they're under alcohol influence, we treat the patient based on their condition that they present to us. And I think it's important that this be a leadership imperative, because we've seen departments where the culture isn't always the best, okay? Where officers look the other way because it's easier to look the other way rather than confront the person and
Right.
say, hey, your behavior wasn't really respectful in that interaction. Let's talk about that.
Yeah.
But we need to do that.
Well, a very unfortunate situation all around, but hopefully some positive change can come as a
Absolutely.
result. Pleasure to have you today. Thank you.
Thank you, Autria.